Status at Quincy Medical Group was recently chosen as a participant for the Lariat suture procedure. It's a life-saving procedure that only 80 physicians' clinics were selected to perform. Thank you very much for joining us this morning, Dr. E, if you don't mind.
Definitely. Thank you, Lindsay. Thank you so much.
Explain
Thanks
a little bit
me.
about what this Lariat suture procedure is.
So it's an outpatient procedure. It can be done in the hospital and the patient can stay just for 1 day. And it's actually a suture that we can do from the groin. We can perform a procedure and put a suture inside the heart. And by doing this suture, patients can stay off blood thinners, especially patients with atrial fibrillation, that they are at a high risk for stroke, and they need to be on Coumadin for life. They can just stop being on Coumadin by just having the suture done in the hospital.
Now, how does it work? You know, you go through the groin, but how do you get to the heart? How does that whole thing work?
Actually, you know, the veins of the legs have been communicating with the heart. So what happens is that it's easy for us, you know, to go from the groin and kind of access the heart through the veins of the groin. So this is how we do this procedure. And you find yourself from the groin suddenly nearby the heart, and you can perform procedures in the heart.
And now, being one of 80 clinics that is allowed to do this or has been selected to do this, what does that mean for Quincy Medical Group?
This is fantastic because we were being chosen as the first clinical tier. That means that we have enough experience to perform this procedure. That's very technical. Believe it or not, a week ago, Barnes-Jewish Hospital, which is a famous hospital in the States, performed their first Lariat procedure. So we're really very close to a tertiary care center with fantastic reputation.
Who will this benefit, and who will be, who will be able to get this done?
This would be patients that they can't tolerate Coumadin. So patients that they have bled on Coumadin, or patients that they are high risk of fall, or patients that they can't tolerate it and have blood thinner levels that they are fluctuating.
Okay. And anything else that people need to know about this? If they're, what kind of, who will be able to get this? Is it just if they have heart problems, or is this for, what is this for?
Patients with atrial fibrillation that they could not tolerate Coumadin, they had bleeding issues, they're high risk for fall. These patients can come to my clinic, they can be evaluated, and they can be set up for this procedure, which is really easy. It's just a 1-day procedure. Patients stay for a day in the hospital, and then they are set for life.
All right. Thank you very much, Dr. E, for joining us this morning, and congratulations for being able to do this procedure.